the Maryland Healthcare Commission. I'm also joined by my colleague, Stacy Howes. She's the Chief of Long-Term Care and Health Plan Quality Initiatives here at MHCC. And we also do have the entire quality team on the line today as well. So today we're going to be talking about our consumer-based website called Maryland Quality Reporting. And this is a website with an incredibly large amount of data that you can use to review and compare up to 5 facilities all in one convenient location. So we're very excited to be hosting this webinar today for you all because we know that as discharge planners or social workers or whatever your role in care management or coordination may be, you really are the gatekeepers to that next level of care once the patient leaves the hospital. So we wanted to be able to share all the resources that we have, and we wanted to be able to demonstrate how you may be able to refer to our website to find specific resources or be able to help patients and their families navigate through all the potential choices they have. We know that finding healthcare can be overwhelming and confusing, but we do hope that our site can help make that a little bit easier. So we will be recording this webinar today and we'll send the slides out afterwards. So everything will be available to you. And I also just wanted to remind everyone to please keep your lines on mute. We do have a lot of people on the phone today, so we want to avoid any potential feedback. So today I'm just going to start with a brief overview of what we do here at the Maryland Healthcare Commission, and then I'll give you a brief overview of the website. I'll show you what type of data we have available and describe the various types of healthcare settings. But really the majority of the webinar today will be a demonstration on how to use, navigate, and access different features. And then we will have some time for questions at the end. The Maryland Healthcare Commission is a state regulatory agency, and we fall under the umbrella of the Maryland Department of Health. Our mission is to plan for health system needs, promote informed decision-making, increase accountability, and improve access in a rapidly changing healthcare environment. So in order to do that, we need to provide timely and accurate information on things like availability, cost, and quality of services. So on this slide here, I've put our org chart. We do have 15 commissioners who are appointed by the governor, and they really help guide our policies and decision-making. We have an executive director and 4 different centers within MHCC. So I'm not going to go through each of these too much in detail, but I'll just give you a quick overview. The Center for Health Facilities Planning and Development is responsible for Certificate of Need programs. The Center for Analysis and Information Services manages our all-payer claims database. The Center for Health IT and Innovative Care Delivery is responsible for advancing health information technology statewide. And the Center for Quality Measurement and Reporting is responsible for public reporting of healthcare quality information. So I put that box in blue because that is where our quality website falls under. So within our center, we are mandated to publicly report healthcare quality information to consumers for a number of different healthcare settings. So this includes hospitals, a number of different long-term care settings, such as nursing homes, assisted living, hospice, adult daycare, and home health. And we also report on outpatient surgery and health plans. And off to the left here, you'll see in this blue box, we have some other priorities, including health disparities and website promotion. And those activities really span across all types of healthcare settings. In order to be able to report all of this information, we maintain our consumer-based website called Maryland Quality Reporting. And I know many of you may have been around for a while, so you might be familiar with our old hospital guide or the consumer guide to long-term care. Back in 2014, we brought together our hospital, long-term care, outpatient, and health plan reporting guides to consolidate all of that information into one comprehensive website. So about a year ago, we did redesign that site to really transform the look and the feel and the functionality. And so now it's a lot more modern and user-friendly. The site provides accurate and timely information, and consumers are able to compare up to 5 facilities at a time to help make informed healthcare decisions. It also promotes transparency and accountability, and it's free and easily accessible online, and it's also mobile friendly. Our data comes from a number of trusted sources. We obtain data from various federal agencies, such as the Center for Medicare and Medicaid Services. We also work with state agencies in Maryland, including the Health Services Cost Review Commission and the Office of Healthcare Quality. We administer some of our own internal surveys each year, and we also get data directly from health plans and other reliable sources I've listed on this slide. We really want users to feel confident in the data that we are using and displaying. And the data sets are updated at varying times. So for example, CMS nursing home compare or hospital compare data are updated quarterly. So we make sure our web updates do align with those as well. And then other data sets may be updated annually or biannually, but we work really hard to ensure that the information reflected on our website is accurate and as up to date as possible. So here I've listed all of the settings that we have data for, and I'll just quickly go through those one more time. So we have information for nursing homes, assisted living facilities, hospice, home health, adult medical daycare, hospitals, ambulatory surgery centers, commercial health benefit plans, providers, and urgent care centers. So this is just a screenshot of our homepage. You'll see I've listed the website URL here at the top. It's healthcarequality.mhcc.maryland.gov. So this link is clickable, so when I send these slides out, you will have access to this. But you could also search Maryland Quality Reporting in any search engine and our site will pop up. So if you just give me a moment, I'm gonna switch over to my browser. Okay, so here's our homepage. And so the first thing that you'll notice is this large search box. So this is, if you're coming to our page for something specific that you want to look for, you can start right here and you can type in, so if you're interested in infections, you can type in infections, and now a list pops up of the type of information we might have. So below that, we have what are called quick links. So these are things that we want people to be able to find quickly. We get a number of questions about these different topic areas. So we want users to be able to access this information, even if it's not something we necessarily handle at the Maryland Healthcare Commission, such as filing a complaint or needing health insurance. But we recognize the importance of these topics, so we want that to be easily accessible and right front and center. We do also have some accessibility features. So right here, you'll notice two different size A's. This is so that you can increase the font size if you need it a little larger. And we also have the ability to translate the website. So if you click on the translate button, it'll translate into over 100 different languages. So we also have several resources here in this left-hand panel. So I'm actually going to skip over these for now because Stacy Howes is going to be describing these different resources a little later on in the presentation. We also, you may have noticed this black banner has been rotating. This is where we keep relevant, timely, or newsworthy information. So these articles and links do change from time to time. So for example, right now, we have a lot of information on COVID, but we do have some information on flu. There we go, learn about the flu. Okay, so really the heart of our website and all that really rich data that we have is down here in these icons. So these represent the 10 healthcare settings that I described a little bit earlier. I'm not going to go through each of these today just for the sake of time, but once you know how to navigate one setting, The rest are pretty easy as well. So today I'm just going to be focusing on nursing homes. So if you're interested in nursing homes, you could click on this icon. And this takes you to another page where you can navigate down a little bit further. So you've got a couple different options. The first option is I need to find a nursing home near me based on, and we can expand out. So now you can find a nursing home based on family surveys and quality ratings, staffing, or daily rates. We pulled out these three topics because this is what consumer focus groups told us was particularly important when searching for a nursing home. So that's why these are highlighted. The second option is I have a nursing home in mind and want to learn more. So if you already have maybe a nursing home in mind around the corner from your house or a family member's house, this would be the best place to start. And the third option is I'm looking for a nursing home by type of service provided. So if you needed something specific like Alzheimer's care or dementia care, this would be a great place to start to narrow down facilities that way. And these last two features are resources and toolkits that provide more information about planning for care. And again, Stacy will be describing that a little later on in detail, so I'm going to skip that. Okay, so I just want to show you if you were to click on any of these options, what it would look like. So if we go under I need to find a nursing home near me based on family surveys and ratings, I'm going to click this button. And now what you'll see is a summary page. So this actually lists over 220 nursing homes in Maryland. All of them are listed. And you can see some overall ratings. There's some family ratings here and some federal ratings. You see the star ratings below. Now each of these are sortable. So you can go from high to low or low to high. Same with the star ratings. And then you can click on the names and that'll alphabetize. So we wouldn't expect anyone to go through every single nursing home to review. So we've made it easy to filter. So we've got a number of different options here at the top. So the first option is to search by services available. So again, you could narrow down if you needed something specific by checking any of these boxes. You could also search by name or by zip code. And then you can also choose the radius within that zip code. Or you could filter down by county. So each of these facilities actually have what we call a profile page. So you can click on any of these facility names, and that'll take you to some more detailed information. So first you'll see here an address, you can find out where it's located and some contact information. And then these pictures actually are real pictures of the facility. So if you're touring the facility and you drive up, this is what it will look like. You'll know what to expect. So if I keep scrolling, we have a number of different options and tabs at the top. You can click on those to skip to those sections, or you can just keep scrolling down. So for today, I'm just going to scroll down so you can see everything that we have available. But first you'll see that we have an overview section. So you can find out more about ownership and licensure and certification. But we also have information on room configuration along with daily rates. If you were interested in seeing how these facilities compare to the state, you can click on this link right here that says Show Maryland Comparison. And this box pops up. And now you can see the average for Maryland nursing homes. So that's a nice feature here as well. And if you don't want to see it, you can just hide it. Okay, so down here, these are what we call accordions. So each of these topics have a lot of measures that you can review. So if you just click on this arrow, it'll expand. So now you see a lot more detail. So anytime you see this little I button in a circle, this gives you more information. So this tells us that this family satisfaction survey topic is from a survey that MHCC conducts every year called the Nursing Home Family Experience Care Survey. So now we know what we're looking at. So now we can see that the percentage of those who would recommend this nursing home at this facility is about 90% compared to Maryland, which is about 80%. So this facility is actually higher than the state average, so that's great. So we can continue to scroll. Anytime you see something in red, it's usually clickable. It'll tell you to click here for more information. So for this particular survey, you can get a full report. It's a printable PDF report for the facility or for the state. So it really just depends on what level of detail that you're interested in. But if there's ever more information, we try to provide it. So now we can keep scrolling, and we see now that we have some information on staffing. So we've got some star ratings, and then you'll see the amount of time that staff spends with residents compared to the Maryland average. I also wanted to point out this flag feature. So this is really nice because we have so many measures and options, and it can get a little bit overwhelming. So if you see something that stands out to you, either good or bad, you can flag it. So as you continue to do research and you can go look through these measures, that will still be there. That will stay highlighted so you can remember what it is that you were interested in. Okay, so I'm going to keep going. We have some federal quality measures. These come from CMS. And so this section is for short-term care for when the resident's stay is less than 100 days. And again, we have the facility rate and then the Maryland rate. And we can keep going. And now we see some long-term care measures. So this is when the resident's stay is equal to or greater than 100 days. Okay. We also have some health and fire safety inspection information, which is pretty important. So you can see the number of inspections and if there were any deficiencies, all that information is here. MHCC also conducts an annual staff influenza vaccination survey. So we have data visible for the last 3 flu seasons right here. So this facility actually performs pretty well. They have a pretty high vaccination rate. And again, as I mentioned, if something is in red and underlined, it's usually clickable and we'll tell you where you can find more information. Okay, we have available services. So again, these are those specialized services that the facility provides. So the green check mark indicates that the service is available, and the black X indicates that the facility does not provide that service. And finally, we have resident characteristics. I really like this section because I think it's colorful and kind of fun to look at. But this gives you a breakdown and more information about the makeup of that facility. And again, we have more information to show the Maryland comparison. So you just scroll down and you'll find more information on how it compares to the state. Okay, so now that you know what type of information we have available, I just want to get into a real life example and show you how you may be able to use this site on a more daily basis. So let's just imagine that we're working with a family to place their mother in a nursing home. So the family all lives pretty close by. They know the general area they want to stay in Baltimore so they can visit mom. And they knew the day was coming. They were kind of expecting this, but this hospitalization was unexpected. And they need to make a decision a little bit quicker than they had been planning on. So this family had a few recommendations from friends, but they would like to see how the facilities compare. So in this instance, we will start at this nursing home icon. And we're back to that navigation page. So since we know the names of the facilities that we're interested in, we're going to choose the second option. I have a nursing home in mind and want to learn more. So this takes you back to that summary page. And again, all of the facilities are listed here. So since I know the names, I'm just going to start typing. So the first facility we want to look at is called the Neighborhoods at St. Elizabeth's. So as you start typing, this field will populate and narrow down. So I'm going to choose this checkbox. And then the second facility we're going to look at is called Peak Healthcare at Caton Manor. So I'm also going to choose this checkbox. And then we have two different places you can compare. So the first is up top here, or you can scroll down and we have a compare button here. So if I click either of those, this brings you to a side-by-side view. So the information we have in this comparison page it's the same information I showed you on those profile pages, but some of it is displayed a little bit differently, but I'll go through that in a second. So the first thing I notice here are these little icons. So I don't know what that means, so I can hover over. And so this first red exclamation point says that this facility has been cited for abuse or neglect during one or more of their last 2 inspections. So that's pretty important information to know right off the bat. So the second icon, I won't read the whole thing, but this essentially says that this nursing home is subject to extra inspections due to some deficiencies. So 2 really important pieces of information. If you ever see anything that looks like it might need more description, try hovering over it and you'll get this little pop-up that will explain it. So we scroll down, you'll see some of that, these overall satisfaction measures that we saw on the previous page, but it's a little bit more graphically displayed. So on the right, you'll see that this facility has, it has some more green, more red hearts, more yellow stars compared to the other facility here on the right. So we can keep scrolling. And now we found some more information about deficiencies, staff influenza vaccination rates, and these services. Okay, and we can keep going. We can see resident characteristics if that's important for your family. And more information about ownership. So for example, this is a church-related facility, and over here, this is a limited liability corporation. Okay. So lots of really great basic information. Of course, daily room rates is always important. And then we get down to those data points again. So again, these look very similar to what I showed you in the profile pages, but if we expand out, we can see each facility is listed, and then it compares to the Maryland score. And I'm going to show you actually, if we expand the staffing. So I had flagged this line earlier when I was showing you the profile page, and it stayed flagged. It stays highlighted. So when you navigate back and forth, it'll easily keep your place for those measures that were important when you were reviewing. Okay. All right, so with our example, this family is going to go through each of these different measures. They're going to review and highlight some things that were particularly important to them. And now they feel like they've got a pretty good handle on the differences in these facilities that they were considering for their mom. So I'm going to turn it over to Stacy House, and she's going to talk about some resources that we have so that the family feels comfortable and they can move forward with their next steps. So give us 1 minute to do a little screen switch.
Can you see my screen?
Yes.
Good afternoon. I'm Stacy Howes. I'm the Chief of Long-Term Care and Health Plan Quality Initiatives. I'd like to show you a little bit about our long-term care planning toolkit and our additional resources. From anywhere on the website, you can navigate to the long-term care planning toolkit because it's always in this red area up top. And when you arrive at the toolkit, you'll see tiles from multiple tools for long-term care planning. And at the bottom, you'll see our email address so that you can request printed materials if you'd like, or you can refer patients and clients to us if you prefer. The first tile is the long-term care toolkit. It includes a planning guide where patients can plan as they age. And it's available in a brochure format and a format that has fewer graphics. Both are printable. It's also available in Spanish. So when you open the brochure, it's filled with information about planning, advanced directives, how to engage in a conversation with your family, worksheets for financial planning, how to research facilities, and additional resources. The next tile includes multiple checklists. So when patients are looking for facilities, you can help them use these checklists to make sure that they're asking the right questions and obtaining good information that will help them decide on what they need. We also offer multiple guides and fact sheets, which complement the checklists. And you or patients can click on any of these to learn more about specific types of facilities like assisted living facilities, or you can learn more about a specific topic like home and community resources or assistance programs. And then next we offer information about advanced directives. So first we have a fact sheet on advanced directives, and it's information about what an advanced directive is, how to make one, and lots of useful links, again in red, just like the website. Also, we have a link directly to My Directives, where you can create your own advanced directive. My Directives is the only advanced directive service recognized by the Maryland Healthcare Commission. And finally, we offer a link to a long-term care cost calculator that's supplied by our partners at the AARP. So in addition to the long-term care planning toolkit, our website has a section with additional resources. And again, it's always listed as an option at the top of the website. So just like the main page, it's separated by facility type. And when you click on a facility type, the page is divided into 2 or 3 sections. For all of the long-term care facilities, you're going to see several of the same documents repeated here that were on the long-term care planning toolkit. But here there are additional useful documents like a brochure describing what the long-term care ombudsman program is and how to contact them. And we also have things like the results of the healthcare worker flu vaccination that we do every year. And at the bottom, you'll notice a section with technical guides. So here you can learn more about where we get our data for that particular facility. Also, there's a document called Data Sources that is a comprehensive list of data sources for every single quality measure that we have on our website. The document is organized by facility type. Now, if you return to the main resources page, there is a tile called Technical Methodology. And here we've collected all of our technical guides into one area, into one location so that you can access them. And if you also combating health disparities is a major state health priority. So if you return to the main resources page here, we have a health disparities tile that contains links to multiple state and national documents, reports, and data about health disparities. And then finally, there is a tile called Other Websites. This is a document. This is a document with a list of other websites that we felt might be helpful to you or a patient. And it's divided into sections such as general resources, aging resources, hospitals, outpatient surgery centers. And all of these underlined in red, are accessible. These are all links to external websites. So thank you, Courtney.
Okay, thanks, Stacy. So we are always looking for ways to promote our website and really engage with community and different stakeholders because we really do want people to be able to find this information and be aware of it. So we do have a presence on a number of different social media platforms that I've listed here. So please feel free to like, share, follow, all that stuff. We would really appreciate it. But you can also feel free to share this information with your facility's social media teams. We would be happy to participate or collaborate in those aspects as well. We also have some digital ads running right now and some print ads that are running in some local newspapers. And we are airing some TV commercials on some national news networks. So if you watch the news while you're drinking your morning coffee or while you're making dinner, keep an ear out. You might hear our 30-second clip advertising our website. As Stacy mentioned, we also have some print materials like hospice brochures and the long-term care toolkit. And we also try to regularly host these type of educational or informational webinars just to really get the word out. And we'll plan to continue hosting these periodically. So if you have team members who weren't able to join today, no worries, we will plan to host more of these. And we're happy to host webinars kind of on demand. So if you have a large team, if there's something specific you'd like for us to present on, we can tailor and focus a presentation for your needs walking through the website. We'd be happy to do that. So we also actually have a couple of slides here from the Maryland Department of Aging. Representatives were planning to join us today to talk about some of their programs, but unfortunately there was a last-minute conflict. So you can see they've got a number of different programs here. And then Liz Woodward, she is the Director of Long-Term Services at the Department of Aging, did ask me to share a little bit more about this last bullet point down here at the bottom, the Hospital Care Transition Services Grant. So she wanted me to mention that the Department of Aging is working to launch a new project to pair area agencies on aging, person-centered options counseling with hospital discharge services to support successful transitions to a community setting. So if you would like to learn more about the department in general or that grant, Liz's contact information is available here. And she said she would be happy to hear from you. So feel free to use it if you need it. Okay, so this is pretty much the end of our slides, but I did leave our email addresses here. We have a general mailbox that we monitor. So if you have any questions, you can always reach us at this mailbox and we will triage and get it to the right person to answer your question. Otherwise, you can feel free to contact Stacy or myself directly. I also included the email address for Mariama Gondo. She is the Chief of Outpatient Quality Initiatives. So I have done a lot of talking, so I'm happy to take a little break and monitor the chat box. So feel free, if you have a question, you can go ahead and either enter it in the chat box or you can unmute yourself and let us know what your question is. And while we're waiting too, I just wanted to say that this is evolving as technology always is. But if you are browsing the website and you're looking for something you don't see, or there's something that you think would be particularly helpful for us to include, just let us know, email us. We would be happy to see if it's something that we can incorporate. So we're definitely flexible. We are always open to feedback and suggestions. So I'm actually not seeing any questions though. There's one. Has IV antibiotic inpatient services for IV drug users been considered as a services available topic? Not specifically. So we are somewhat limited with the data that we have available, but it's definitely something that we can monitor and consider for the future. Okay, so Janet, your question is there someone assigned to monitor the website to ensure information is updated? So our whole team is sort of in charge of this. So if you remember back on the org chart, I listed each of our names. So each person on the quality team is sort of responsible for a different setting. So for example, if there is an update to CMS Care Compare for hospitals, I make sure that that information gets updated in a timely manner. If it was nursing homes, that would be Stacy's area. So we are constantly updating measures. So it's kind of ongoing maintenance. Can an option be added to search for resources for bariatric patients? I think I'm going to toss that over to Stacy, but I believe those services they come from the long-term care survey. Is that correct, Stacy? So I'm not sure if we have that information.
I would have to look into that and see if we asked that information. I don't believe that we do, though.
Okay. It looks like the next question might be for you too, Stacy. It's, do you plan to expand the website to include skilled nursing facilities and or long-term care?
The information that's on the website is skilled nursing facility information from both CMS data and the data that we collect. Was there something more specific that you were wondering about, Jennifer?
And I'm just thinking maybe about Jennifer's question. If you're referring to long-term care acute hospitals, we actually don't have authority over that, so we won't have information on that. And then maybe a separate tab besides the nursing home tab.
We do not, as Courtney said, I see what you're saying now. As Courtney said, we do not have authority over the acute care ones. We have the 224 nursing homes that are on our website. It's every single one that's in Maryland, but it's not the acute care levels.
Yeah, these are great questions. Please keep them coming. And we would definitely be grateful if you would share this website with your colleagues. And feel free that you can give our information out as well if they have any questions. We are definitely happy to chat. Our entire team's contact information is also on the website as well. Okay, so Janet's question is, do you have resources for psychiatric hospitals and outpatient psychiatric services like PHP, PRP, or IOP? So again, we don't have authority over the psychiatric hospitals. So we don't have much information for that, but that could be something where we create a brief fact sheet so we could still have some brief information if that would be helpful, something we can consider. Great. Well, I am not seeing any more questions. I'm happy to hang on the line a little bit longer, but hopefully this was useful for you and you learned something. Hope that you can take this back to your teams and share it with them. And of course, as I said, was home health included? Yes, it was. Let me go back to these settings. Okay, so here's a screenshot. So you'll see home health right here. All right, so I will send this recording and these slides out. I know this is a lot of information to consume and try to process all in 41 minutes. But please do take a look. Let us know what you like. How about freestanding medical centers? So we don't have that information yet, but we are building up our outpatient surgery section. So we'll have information there. But these are all great suggestions, all things for us to consider. So we do appreciate that. Yeah, no problem, Karen. All right, so I think we will call it a day and give you back a little extra time. So we do really appreciate your participation today. I'm glad this was helpful. Got some nice comments in the chat box. So again, feel free to let us know your feedback or any questions you might have. We'll plan to host these more in the future. So hopefully you can join us again or share with your teammates, and we're looking forward to it. All right, thank you. Bye-bye.